So, I don't know, did you bring the pictures? I brought some.
I can go get it.
Oh, that's fine, that's fine. I brought some pictures, but they didn't come out right, but that's okay. I can still pass them out.
You want me to bring your picture from my office? And
That's fine.
When you lose weight, you get to be on my wall of fame.
I'll pass these out. I brought 2 copies for each side. They just didn't come out right. It cropped out my face. Just look at that. So I had surgery 3 years ago, December 2011. My highest weight was 345 pounds. Pre-op I was 320. Day of surgery I was 304. It took me 15 months to get to my under goal weight, which was I think 145 pounds. And then I maintained my weight for about until November of 2013, and then I stopped exercising. I wasn't eating right, and then I went up all the way to 200 pounds, so 208 pounds to be exact. I saw Dr. Lega in December last year, 208 pounds, and he wasn't very happy, of course. So he told me I have to lose 40 pounds, and on this coast I've lost 36 already. So I'm like, this close now. He wants my BMI to be 25. I think this is 27, right? So this is. I wanted to show you this. I think it's in one of the pictures. This was my shirt. It was 3X. So, and then I have this. These were one of my pants. And in one of the pictures, I'm standing in one of the. I fit in one leg, by the way. So these were my pants. I think they're 24. So I'm like a size 8 now. So when I gained weight, like in the past year, I went back to like a size 12. So I mean, it's really easy, guys, to go back, you know, to the way I was before the surgery. I mean, surgery is just a tool. You know, I stopped exercising and, you know, eating the way I was before, and it's very easy to fall back again. So if you're looking to get, you know, a quick fix, it's not the way. So I got back on track. I started going back to the gym. I get up in the morning at 5. So I started eating, you know, healthy again, and so I started seeing Seema again, and she got me back on track. So started doing this all over again for me, you know. Not diabetic anymore, now medication. I don't have sleep apnea, I don't have hypertension, you know. So I did it all for me. I don't want to be, you know, tired when I go up the stairs, or yes, if you are thinking about it, this is like the first time you're here. I really, you know, recommend you to look into it, and it's for you. I mean, just prove yourself. Don't prove anybody else, you know, that you're doing it. Just prove yourself, nobody else. That you want to do that. Do you guys have any questions?
I guess a fear of mine is not being able to get rid of like loose or hanging skin. Do you have any suggestions, like for people, like is there a way to prevent it, like before surgery, like having loose skin?
A lot of people, you know, have a lot of fear about that. I mean, I've lost 170 pounds, and I have loose skin, and Dr. Lega referred me to the plastic surgeon. My insurance didn't approve the surgery to get it removed. But I mean, there's so much you can do with, you know, exercise and, you know, weightlifting and stuff like that. But there's still gonna be loose skin and stuff. But I mean, they have financing options that you can do if the insurance doesn't approve. Well, a lot of the times the insurance does approve it because of medical necessity. But those are two of the options that you have. Any more questions?
Myself, I lost 8 pounds in 1 year because I did the diet, California Medical Weight Management, and I experienced, like, I literally went bald. I lost, and I forgot to ask that question to Dr. Lee. I seriously went bald. It was traumatic. So I'm just curious how you experienced that.
I lost a lot of hair too. The first year, technically, you're supposed to start growing back your hair the year after. I mean, your body goes into a shock the first year after the surgery. So yeah, so technically, I mean, you're supposed to, you know, take all your vitamins. I mean, I take biotin 5,000 micrograms every day. I take all these types of vitamins, hair shampoos. I mean, I try everything. So anything that you can do for your hair, I do it. Juices, everything. But yeah, it is known to have, you know, that's one of the side effects, the hair loss, because your body goes into shock. But after the first year, your hair is still growing. I have like baby hairs right here.
It was scary. I mean, it was so scary.
Yeah, even after 3 years post-op, my hair is still growing back, but you know, it's worth it. I got my health back, you know. I'm no longer diabetic. I'm no longer, you know, almost 350 pounds. You know, I'd rather, you know, lose a little hair, it's growing back, than, you know, a little hair. Who cares? So.
Chunks, like literally. It was scary.
Now compared to, say, the first year, how much do you eat in one sitting? How much, like, say, versus...
One sitting?
Like, is it, like, say, a cup worth, or has your stomach expanded much? Can you tell?
From the beginning, I mean, from the beginning, it's different. It has expanded, of course, because I'm 3 years, almost 4 months post-op. And I mean, maybe like I can eat half, like from like piece of chicken like this, and like half a cup of like brown rice, and then I'll be full. So it really depends. Like I could eat like this much of like chicken and then be full, or like eat a little bit more and like be like, oh my god, I'm so full. It really depends. So I can still be satisfied even at 3-year post-op. So yeah, it's a very good tool. You just have to, you know how to use it. So.
Do you have any cravings for anything?
Of course, yeah. I just gotta learn how to control them.
No, you didn't. I had surgery 13 years ago. That's something you just write.
Yeah,
Sugar.
yeah.
Sugar.
We're all human, right?
Yeah, and that's why I said if somebody asks you about artificial sweeteners, you use that to prevent you from eating sugars, but that actually initiates the craving cycle. So the less you use that, you're better off. And if you use the fruits more, it will satisfy you than using the artificially sweetened foods. So keep that in mind for cravings.
So take my testimony as, you know, something to keep in mind. I fell hard, and, you know, when I came in to see Dr. Lega, he told me, do you want to be, you know, that person again, almost 350 pounds, diabetic, with sleep apnea, high blood pressure, being on all those types of medications again. You know, I've had patients who have come back and have gained all that weight. Do you want to be that same person again? Be depressed, be, you know, introverted and, you know, withdrawn and not have any friends, be stuck at home, not be able to do anything because you don't have any friends and, you know. And I'm like, no, I don't want to be that same person again. I'm like thinking to myself, what am I doing? What am I doing to myself? So I'm like, the next day I just, you know, get back to the gym, you know, start doing this swallow again. I know what I'm doing. I went back to my notes. I still had them from when I was seeing SEMA. Start drinking water again, back to the gym, get everything back to the basics. So I'm still doing it, and I'm not gonna, you know, stop. Any questions?
What is most challenging to you?
Tell you the truth, is like getting up in the morning to exercise, to just get out there. Once I'm there, I'm fine. Just getting there, yeah, that's the main thing.
And the reason I invited Maria to come and talk today is because she had a fabulous journey, and then there was a setback. But the way she bounced back, and she proved to me that, you know, she's really gotten it this time. And that's why I invited her. So I'm very proud of you.
Thank you.
For doing that.